Hypercoagulability can be acquired, like it can be inherited and it can be acquired as well. So here we are going to discuss about the causes that are the acquired causes of hypercoagulability. In most of the cases, the venous stasis and the increased platelet activation. Now, both of these things, whenever there is a venous stasis and there is the increased platelet activation because of any other cause, any other etiology, any other disease, the platelet activation is increased either because of the overactivation of some factors or some kind of the other disorders, that both of things will lead to acquired hypercoagulable state in the body. Now, there is no defect in the gene, no defect in that is inherited, and no underlying deficiency in the factor or overactivation of the factor, no deficiency of antithrombin. Rather, there is the venous stasis and the increased platelet activation that are leading to the acquired hypercoagulable state.